I always like tilt my head to the side, and I don't know why. But I've just noticed that. Maybe you guys haven't. Thank you for joining us for another episode of Branching Out with F&M Bank. I'm your host, Mary Pavlovskaya, and today I'm joined by Dr. Yuri Zhukov, cardiothoracic surgeon at Sentara RMH. Thanks for joining me, Dr. Zhukov.
My pleasure, my pleasure.
Well, this is a very interesting way to hold a video in a hospital.
I suppose we could do it in the worst place, but let's start talking about February being a heart month.
Yes, tell us a little bit.
Heart disease, interestingly enough, and the data I have on that, the last data I looked was pre-COVID, but heart disease is still biggest killer of the Americans, and at least in 2018 there were more than 90 million Americans with cardiovascular disease of some sort. In fact, pre-COVID there was one cardiovascular related death every 36 seconds. That's how prevalent heart disease is. Now, unfortunately, you know, it's so prevalent, it's kind of an elephant in the room. We don't focus on it, and particularly lately, COVID took a center stage. But cardiac disease, we don't see it going away. It's just it's still there, and we're still working on addressing that.
Yeah, and it seems you of all people in your industry specifically, you had to just adjust so drastically when the pandemic came because people still kept getting sick and you still get heart attacks, and so tell us what that was like.
So we've learned a tremendous amount over the past year. When, you know, a year ago when we were just about this time, when we noticed a spike of COVID initially in New York and then across the country, and how to deal with it, how to continue running the hospital and accommodate the new patients that we didn't know how they fare, what kind of care they need. We knew they're sick, and they were. And so we've learned a tremendous amount. Most recent data from Society of Thoracic Surgeons, in fact, released 1 week ago at the annual meeting, which unfortunately due to COVID had to be held virtually as well. It suggested that the volume of heart surgery in the United States dropped by 53%.
Wow. More
so for elective surgery than urgent surgery, and as you stated, the emergent things don't go away because of the COVID, but we have seen a decrease in volume. What that means, we don't know yet. Why do these patients no longer come in? Whether it's a limitation of access to care, whether it's patients who are otherwise, affected by COVID and dying from this disease before their heart health becomes an issue. So that's yet to be determined. But we've seen a decrease in that. And then logistically, what we've seen with COVID is that the ability to provide care now has another factor. Is we have to factor in what are the COVID numbers. In the past 12 months, we had 2 major spikes in the community that put the hospital at such strain that we have to make difficult decisions. And some of them aren't as difficult. Do we perform a procedure that could be safely deferred by 1 to 2 months? Now, it's okay for something that, for a condition that's chronic. What do you do with patients who have heart failure? What do you do for patients who have lung cancer? And deferring that may be detrimental. So these are all things we've learned over past years.
And it sounds like even though the people that are coming in with just the regular surgeries that you're having to perform, you're seeing the heart surgery piece of it and you're seeing the COVID piece of it. So how are you seeing that COVID's affecting these patients?
When we spoke about the access, the availability of beds, availability of nurses, availability of staffing. Also, we've had multiple instances where patients do their pre-admission testing and everybody gets a COVID test these days. And there are patients who are asymptomatic and their COVID is positive. That delays their care. And then more recently, fortunately, now that the vaccine is available, we have to mitigate the timing of their vaccine and timing of their medical care, timing of their surgery, because we do not want to interfere with the both doses of the vaccine, and ideally we should delay major surgery by 14 days after the second dose of the vaccine. So we have some of these patients that will need certain intervention done, but they are in queue while they're getting their vaccine.
And talking about heart health specifically, some advice that you would give just to the general public of what's important to keep in mind during this time period, and what's things that they just need to remember that are going to help?
We've been talking about heart health for decades, and it's not. I think COVID highlights it because patients who do have cardiovascular risk factors, they're at the highest risk of severe COVID disease. So patients with high blood pressure, patients with diabetes, patients with pre-existing heart disease, coronary artery disease, valve disease, heart failure, people who smoke actively or who have significant COPD, those patients are at an increased risk of significant COVID infection. So if we turn that around, I think it's more important than ever to make sure we're making all those small right choices so that the risk, so we mitigate that risk. So abstinence from cigarettes, avoiding or at least minimizing alcohol use, activity, diet, and these are the things we've been talking about for a while. Unfortunately, you do not see the benefit of this very quickly. It's not, it's kind of like brushing your teeth. If you brush them once, nothing happens. You have to brush them twice a day for many years, and then you get to keep your teeth. Same with heart health. It doesn't help if you exercise today. And also, once again, COVID keeps its reach into all the aspects. So people who used to go to the gym now have to find out how to do that. And in the time of COVID, gyms get closed, reopened, and you never know what's safe or what's smart. I had to make a small gym in my basement because that's what's acceptable.
Yeah, no, I think a lot of people had to, and that's good to keep that in mind, that those are important factors that people have to consider in going forward, knowing that it's important for their health and can help them in the event that they get.
Certainly, the healthier you are, the better chances you have if you contract COVID. And certainly the best thing we can do is not get COVID, meaning hand washing, meaning maintaining proper distancing, choosing what risks do we take. Is that gathering really important, to warrant the risk of contracting COVID? And then certainly wearing masks, even with the vaccine. So what we've looked at is, vaccines have been developed over the past year and studied over the past year, so we don't have a long track record, but what we do know is they're effective. So getting a vaccine, particularly if you're in a high-risk category, it's extremely important. And for the record, I've got both doses. I'm extremely happy that I did not have problems with it. But the other part is we don't know if people who have vaccine are able to transmit the virus. We just haven't studied that. And so a lot of patients or a lot of people in the community would say, well, I got the vaccine, why do I need a mask? The answer is we don't know. We don't know if you do need a mask or not, but being a prudent person, we've worn masks for the past year, and yes, they're kind of stuffy. And yes, they'll muffle the voice, and yes, we can't see your smile, but it's probably, for right now, it's probably better to be on the cautious side. So yes, wearing masks even after you've got a vaccine.
So thank you again, Dr. Zhukov, for talking to us about cardiovascular health and reminding us to make sure to wear our masks and to be safe and to help our community.
It's my pleasure.
Absolutely. Thank you for joining us for another episode of Branching Out with F&M Bank.